This video will tell you about how to use an emergency treatment that could save someone's life. It is called naloxone. Another name for this treatment is Narcan. It is used when someone is experiencing an overdose from a type of drug called an opioid. Here are some of the names of opioids: heroin, fentanyl, oxycodone, and hydrocodone. An overdose is when someone has taken too many opioids. If someone has overdosed, their skin may be cold and sweaty. The person might look like they are asleep and are unable to wake up, even when you call their name or shake them. The person may not be breathing normally. They may not be breathing at all. The skin under their fingertips or their lips may be blue, purple, or grey in color. These are all possible signs of an opioid overdose. An overdose of an opioid could end up in the person dying. If you can give Narcan right away, it can help someone start breathing again. It can save lives. If you see someone who you cannot wake up and may not be breathing normally, they may be having an opioid overdose. You should call 911 right away. The person who answers the phone will ask for your address. Please tell them. If you can describe in English the reason for your call, tell them. You could say, "My friend is not breathing and is not awake." Please ask for an interpreter if you need one, saying the language you speak. If you cannot wake the person up right away by shouting their name or rubbing your knuckles on their chest, you need to give them Narcan. To use the Narcan, firstly, remove it from its packaging. Tilt the person's head back to make sure that their airway is clear. The plunger is what you push to get the Narcan into the person's nose. Hold your thumb on the plunger and place the tip of the spray in either nostril until your fingers are touching their nose. Firmly press the plunger to release all the medication into the nose. Wait 2 or 3 minutes for the person to respond and start breathing again. If the person is not breathing normally, begin rescue breathing and chest compressions. A rescue breath is when you place your mouth on the other person's mouth and give 2 small breaths into their mouth. Tilt the person's head back and slightly lift their chin. Make sure their airway is clear. Give 2 rescue breaths, watching to see their chest rise. Then, give 30 chest compressions. Here's how. Place the heel of one hand on the center of the person's chest. Place the heel of the other hand on top of the first hand so that the hands are overlapping. Push hard and fast. Push down 2 inches deep for anyone over the age of 1. Allow the chest to fully return to its normal position after each compression. For every 2 rescue breaths, give 30 chest compressions within the space of a minute. You should be giving between 100 and 120 compressions in 1 minute. Some people count out loud to know how many they have done. If the person continues not to breathe, use another container of Narcan, switching nostrils. Keep changing between rescue breaths and chest compressions until the person moves or the ambulance arrives. If the person wakes up after an overdose, they might be confused and not know what has happened. Sometimes, the effects of the Narcan will only last about 30 minutes. This means there's still a chance that the person will overdose again. If the person becomes unconscious again, give more Narcan and begin the chest compressions and rescue breathing. If you or someone you know is struggling with opioids, you can get Narcan to carry with you, or you can keep it with your other medications at home. Narcan is available at some pharmacies or for free at distribution sites throughout Vermont.